Hello, so a little intro to the Chalk Talk on 11 secrets to eliminating or solving or preventing lower back pain. So we recognize genetics, previous injuries, things like that, they put us where we are. But there's things you can do to prevent, eliminate back pain if you happen to be one that gets it. So prevention really is our key, right? We'll talk about prevention, treatments, and things you can do to reinforce your solutions. So prevention boils down to trauma, toxicity, and thought. But we're going to talk about, in trauma category, we'll talk about structural, trauma to muscle and joint, posture. So sitting, this is important, right? Sit too long and it's a problem. We'll talk about how to sit correctly, and we'll do a little demo in here. We'll take a person and show sitting exactly how to do it and the secrets to how to do it wrong. But of course, not sitting too much is the first thing to remember. So we'll talk about exercise, aerobic exercise, resistance exercise, and the core ×4 exercise to prevent and eliminate lower back pain. We'll talk about nutrition. We'll talk about an eating program that has been shown to reduce the incidence of Alzheimer's, dementia, cancer, diabetes, stroke. You'll want to know about that. And of course, lower back pain. Next is mental. So this is still under prevention. Mental stress is important. We'll show a device that helps you track your own stress. Like, am I relaxed right now? And if I'm not, then what does it take for me to get to that point? And intentionality. That's a little more tricky, but we'll talk about that. One of the keys to sudden lower back pain injuries is whether you had a good attention. And also, we'll talk about intention when you do your exercise to get the most out of it. And then in treatment, we'll talk about stabilizing specifically. We'll talk about little tools like SI belt versus lumbar belt. What's even the difference? Well, knowing the difference and using the right tool can be the key to your getting well or you're going on to surgery. And what about if you have a sudden episode, your chiropractor is out of town, or it's too late, you just don't want to call them on the weekend? Is there something you can do now? And yes, there is. But if you do it wrong, you may get worse. So do you have an SI joint problem or a lumbar disc problem? It matters. So I'll show you how to do it. We'll demonstrate it live on video for you. So next, strengthening. That's where we come to our core ×4. But I'm going to leave that for later. And normalizing the nervous system. So it's not in your head, but chronic pain is in your brain. Meaning the longer you have chronic pain and the more complicated the issue is, the more you may have changes in your brain that make it hard to get rid of the pain. And there are ways to normalize that mapping in your brain. And then finally, our next is Nourishing Naturally. That's the final portion of the treatment. We'll talk about that diet I told you about, the eating plan, specific supplements that I've found to be helpful, and tests that can be helpful as well in the nutrition category. And finally, reinforcement. Avoid those hyped back pain products that do you no good, but make sure you use the ones that do help. We'll talk about the inversion table, shoe inserts, and a back device that you sit on when you're in the car or in your home. So join us, and I hope we have a lot to share with you. I know we do, and I hope you get a lot out of it. Thanks.